We're going to talk about erectile dysfunction because there are more and more younger people have these issues, low testosterone. And I find out the testosterone is actually not directly related with the ED because I have patients, their testosterone is like below 300, which is very low after prostate cancer treatment, and they still have normal erectile function. So I think the most important thing for men to have normal function is the circulation and also the nerve function.
Yes.
Yeah.
Exactly.
So when they go through the prostate cancer treatment, there are a lot of nerve damage. So and definitely the circulation is compromised. So improving the circulation and resume normal nerve function with acupuncture once or twice a week. And also if they want some kind of supplement, which one you recommend?
Yeah, I think L-arginine can help a little bit if it's a circulatory, issue, and then nervous system issue, potentially alpha-lipoic acid if it's diabetic, or depending on the cause of the neurological issue.
Yes. So L-arginine, you find out some kind of study to show it helps this erectile dysfunction. Is that right?
Yeah, there's some studies that showed it might help improve the erectile dysfunction, even on top of Cialis, like in addition to that.
Yeah. So if they can combine, like they would do low dosage L-arginine, and then if they need it, they can use Viagra or other strong medication, and that probably can lower the dosage because there is a urologist from China, and he basically presented with the acupuncture and herbs, but he gave me an idea that when they have bad experiences, they have like ED for a while, then psychologically they kind of lose the confidence.
Right.
And so he recommended initially when you do the herbs and the acupuncture, they would give like Viagra for a shorter period of time, and then once the blood flow get improved, because it takes time for herbs or the supplement to take effect.
Right.
But Viagra is a direct the blood flow right there.
Right.
Even you have to see the contraindication if the heart problems, right?
Right.
Yeah.
Right.
So we really have to, if we can combine the supplements, herbs, and acupuncture, and that will give people the confidence, and then they can have a jump start. And once with the treatment, with the L-arginine, with the acupuncture, once they could have the healthy blood circulation, then they can stop the Viagra, right?
Right, right. And it depends on the underlying cause,
Yes.
So if you're talking about something like prostate cancer or after some type of surgery, then yeah, it's going to be a process for them to really recover. And so acupuncture could be very important for helping, with that recovery process.
So L-arginine, what other effect it has? Is that a building block? Is that a amino acid? So the L-arginine, I find I used to have canker sore, and so I talked to a guy in gym who is a bodybuilder, and I asked him, I said, I don't know why I have this canker sore each time I take dark chocolate, if I take more. And he mentioned L-arginine. He said L-arginine is very rich in dark chocolate, and I think nuts also have L-arginine, because when I take nuts plus chocolate put together, then I definitely will develop a canker sore.
Interesting.
Yeah. So it seems like it suppressed the immune system. So canker sore is kind of a virus infection, right?
It could be, or it could just be maybe inflammation, right?
Yes.
Or some negative immune reaction to something. Right?
So L-arginine, I think, not only can help the ED, but also I think it can suppress a little bit the immune system. So in that sense, if you go through the hormone changes and then you take too much dark chocolate, and then your immune system can be suppressed too much, right?
I think L-arginine is thought to maybe increase nitric oxide release, in the endothelium, which is the inside lining of the blood vessels. So that's supposed to help with circulation and dilating blood vessels, nitric oxide.
Yes, I think that the study you read, is that 3 month or 6 month?
I don't remember offhand.
Okay.
Yeah.
The 3 months, usually the standard study is 3 months. So I think L-arginine, you can try that if you have the problem. And combining different method, you can avoid high dosage of Viagra.
Right, yeah, and I think it's very safe to take too.
Yeah. So one of the side effects I heard is the vision problem, because you switch all the blood flow to one area, and you dilate the peripheral blood vessel, and then your vision, you can lose the blood flow to your retina, optic nerve.
Well, that definitely depends on the dosing.
Yes.
I don't know how much someone's taking.
That's why.
So always start very low,
dosage.
right? Just to be careful.
Yes, and the other thing, we were talking about meditation. I don't know how you do your meditation, but I do mine always lying down. The reason is because when you meditate, your blood pressure tends to be low. And then if you're sitting there, then you really reduce the blood flow to your eyes. And for the older people, it can cause like the atrophy of the optic nerve or dry macular. So I really encourage people to lie down. And people will argue with me, traditionally meditation, you always have to sit there, you cannot lie down, then you fall asleep. I was like, you don't have to fall asleep, right? To prevent from falling asleep, you can do acupressure. Like if you lying down for 20 minutes and you don't want to fall asleep, so you choose the point around the eyes, around the wrist, and I find if I press those points and then I do my meditation, it seems that I don't fall asleep. But at the meantime, while you deep breathe in, you dilate all the blood vessel and you press certain acupressure point, then you redirect the energy to your heart, to your eyes. But if you're sitting there, your eyes just reduce the blood flow. So that's.
I think it is better to lie down also.
Yeah. Did you do your lie down?
I did. Yeah.
You did?
Yeah.
Oh, okay.
Yeah, because then the blood flow is just very even, right? You don't have differences because of gravity. So I think that
exactly.
can really help.
Yeah, and yes, the high blood pressure people may be able to sit there, but me, whenever I sitting there and meditate, and I always feel tired afterwards, and but 20 minutes lying down, even I don't fall asleep, I rejuvenate myself. And I was thinking, what is the mechanism? I think by just lying down, doing the deep breathing, then you bring the energy to your adrenal gland. You recharge your adrenal gland. Then you have this, 2-3 o'clock is when cortisol is the lowest, right? So when at that time, if you do have time to do 20 minutes lying down meditation, you actually bring up your cortisol a little bit, so you won't feel extremely tired, and you can stay up until 8-9 p.m. In that way, you will follow your normal routine. If you go to bed at 8 p.m., I guarantee that you'll wake up at 2 or 3. That's my experience.
Yeah, you have to have like a regular, consistent bedtime schedule, and the sunlight exposure can help, because being indoors all day just disorients.
Yes, people. Yes. So when do you go to bed? Because you're such a good
usually
sleeper.
Like 10:30, maybe 11.
Yeah, 10:30 to 11 is the good time to get chunk of deep sleep.
It's interesting because it depends where I am, because when I stayed on like a permaculture kind of place in Japan for like a week, and we didn't have any electricity, and so when you don't have that, the birds wake you up at like 4 a.m. because the sun's kind of rising.
Yes.
So you just naturally adjust to going to bed at like 6 or 7 p.m. when it gets dark, and then you wake up at like 4 or 5 a.m.
But then
so
you
my
also,
whole cycle shifted, you know?
you changed because you don't have stress daily, right?
Right.
You're physically active, and by 6, 7 p.m., you're exhausted.
Right.
Yeah,
That's
and you
true.
don't think too much.